First scanning position is the anterior ankle. We're going to take a look at the talocrural joint. First, we're going to start off with a long axis. I'm going to place the probe on like this. And the two structures that you're going to identify are to the left. That's proximal. The tibia. So this is the tibial bone. It goes down here. You see that it goes down in a nice line like that. And then we go a bit more distal, and then we see the next bone here, that is the talus. So the talus consists of a proximal part, which is the talar dome. Talar dome is covered here in cartilage. That's the anechoic line you see there. Then we go more distal, and you will see that the cortical bone will make a small dip. With some people it will be a bigger dip, but that would be the neck of the talus. So with the talar dome, talar neck, and we go even further distal, and the bone will go up, 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 up until here, and this will be the talar head. We scan towards the next joint. Here it's a tiny joint, and this is the bone, this is the navicular bone, and this is the navicular between the talus and the navicular. It's a joint space, and the ligament you can see here, this is the capsule overlying that specific joint. Now we go back. Here in this area, if there is any fluid accumulation, that usually starts here around the neck, and when you get a bit more severe fluid, it will start to expand here over the talar dome towards here. Then we take a look at the overlying structures. So this here is fat tissue. That fat tissue is intracapsular because the capsule is this structure overlying here. So this is the capsule, this is the fat pad, which is intracapsular, and then underneath it here you would have the fluid, and in this specific individual we don't have any fluid inside the joint. Here we see an artery passing over. This is the arteria dorsalis pedis. I don't know the exact term in English, but you can see that it's running over the joint here. Important in the long axis is to scan the whole joint, because if I take a short peek in the short axis, you can see that the cartilage is quite wide. So if you want to scan the whole cartilage, we're just here at this point above the arteria. So we go back to the long axis view, which we have to make sure to scan the whole joint. So we scan the talar dome, then we go, first we go medial, 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 we follow it, and we still see cartilage, 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 and at some point here we still have some cartilage, and then here we lose it. So that means that we went all the way over the medial side of the talus. Then we go lateral again, we get the cartilage, see it very nicely, then we go lateral, and if we go lateral, then the bone here will start to go up because the lateral side of the talus is a bit higher. So we go lateral, 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 we see it coming up, see it's higher, 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 higher. It's very superficial now, still cartilage on top, and then at some point here you're going to lose it, and then you're over it. So make sure that you swipe over the whole joint from left to right, so you get a nice complete overview. Then we switch to the short axis, like so. Here we see the cartilage right there. That's the arteria. If we go take a look at the tissues above it, the big tendon right there, that's the tibialis anterior. It crosses over the most medial edge of the cartilage here. You can follow it upwards a bit if you like. You see that it's a very long and slender tendon. We go down, back to the cartilage. Then we go a bit more lateral. Then this would be the extensor hallucis longus. Here it gets a muscle belly. You can also follow that one up if you like. And you go down. And then to the most lateral part here of the joint. Here we also see some tendons. Those are the tendons of the digitorum, and you can follow those up if you like as well. And then you see that they get a muscle belly right there. Okay, so that's the long axis and the short axis of the anterior talocrural joint.